where the state's Health Minister, Brad Hazzard, is providing a COVID update.
Moving about Sydney this morning and just seeing and talking to folks across New South Wales, I think it's fair to say there has been, in a sense, the great New South Wales bust out. People have had, they're rewarding themselves after many weeks of sacrifice, of having themselves locked inside. And we all deserve it. We've all worked very hard at it. So I don't want to dissuade people from enjoying what is a fantastic state and at the moment fantastic weather for this time of the year. But I also do want to remind people that this virus is extremely dangerous and we are all, every one of us, sitting ducks for this virus. We don't know where this virus might break out and it can be extremely dangerous to various sections of the community. We hopefully now know that people with comorbidities, other health issues, if you're over the age of about 50, it can be particularly dangerous. If you're over 70, it's just plain dangerous. So particularly people with comorbidities, other health issues and people over the age of 70 still need to be very, very cautious. I remind everybody that other countries have not done so well as we have done. And many of them have lost many of their citizens. Many of them have had many people who've ended up in intensive care units and unfortunately many people die. But the preliminary evidence from those overseas jurisdictions is even when you have that level of disaster and death, the herd immunity that is built up is still very, very modest, and somewhere in the range of 5 to 10% is what's generally being talked about at the moment. So in our state, where we know we've had a relatively good outcome compared to other parts of the world, we could largely expect that most of us do not have that immunity. We have not built up an immunity. And so for the time being, I would just like to warn everybody that we are still vulnerable and our great bust out has to be tempered. We have to temper it in a way that when we go out, we're still exercising that social distancing. The 1.5 metres is a magic figure. It can keep you safe. I know, again, I've observed today people at cafes and restaurants, and many of them do not appear to be exercising that 1.5 metres. Look, I just say to them, please be careful, please be careful. And to people who are conducting the cafes and restaurants, please also exercise care and caution when you're putting the chairs out around the tables. If you could just space them a little further apart and just talk a little louder if you're out having a coffee, then that probably works and it would keep you safe. I do want to emphasise the issue of also going to dinners and going to cafes and restaurants comes with dangers. We have had situations. One of the things that has occurred, which has been done remarkably by the health staff here in New South Wales, and indeed ADF staff, Army, Navy and Air Force, who've worked in this very building where I am now, tracing contacts of people who are confirmed COVID cases. And it's a challenge for them, but I would think it's also a bit of disappointment, it certainly is to me a bit of disappointment as Health Minister, to hear that people with runny noses, people with symptoms, are still going out to visit friends in their houses. And in fact, I'm very aware of situations where, for example, one particular person, just thinking of one, who had a runny nose, went with that person's partner to dinner at a friend's place, and it turned out that the person with a runny nose did have COVID. The partner has COVID. Well, in a sense, living together, that's probably more understandable, but the risk factors to the friends, and we're now having to do all those tests, that is, New South Wales Health is having to do all those tests to see what is the impact. As I said, I think we all need to take the message that if you have, it's been said 1,000 times, in fact probably more than 1,000 times, if you have any symptoms of a cough or a cold, a cough, running nose, a bit of a temperature, don't go to work, but don't go out. And certainly don't go and put your friends at risk, and definitely don't put anybody over the age of 70 at risk, and don't put anybody over the age of 50 with other health conditions. Just stay home. Stay home till you're better, but go and get tested as well. That's an important part of the message. Go and get tested. We're living in dangerous times. We can still have fun. but they're dangerous times until we sort this virus issue out. Today I'll also be just announcing that the government, when people present to emergency departments in the normal course, it can be a stressful situation. You don't normally go to an emergency department unless you have a stressful medical situation. And in these COVID times, when I think we're all feeling a much higher level of anxiety, and many of us are still scared about what might happen, I think that to have a change in the way people can be dealt or looked after in an emergency department is a real plus. So the government is putting $8.6 million into ensuring that there be additional people in each of these emergency departments who will be able to look after you. These will be effectively experienced people who will manage the experience in the emergency departments. And we've trialled them. We trialled them at Lismore, Blacktown, Nepean, and I think one other hospital. And it was very positive. And today we'll have Deb Wilcox just talk about what she's planning on doing for the Northern Sydney Local Health District, because she's very aware of the pluses of what's happened in other areas. Being a senior executive, she's spoken to other senior executives in those areas who have had very positive outcomes. And I think for patients, that's a fantastic position to have someone who's a patient experience manager right there in the ED, in the emergency department. It also works for the staff. It takes the stress off the staff, because a lot of patients don't want to interrupt the doctor, don't want to interrupt the nurse. But if you've got someone who doesn't mind being interrupted, and also have capacity to perhaps charge your phone and so on. I'll leave her to talk about the details. But the government is absolutely committed to put this particular new person in our EDs to make life better.